So elbow joint is a trochoginglymoid joint. Trocho is T-R-O-C-H-O and ginglymus G-I-N-G-L-Y-M-U-S. Trochoginglymoid joint. Ginglymus means a hinge and trocho means a wheel. That denotes a pivotal movement. হুইল কিরকম হয়, একটা অ্যাক্সিস হয়, তাই না? অ্যাক্সিসটা, the attachment side to a wheel axis is the pivotal point, right? This car wheel are moving like this, so the head of the radius is also moves like this, and the head of the capitulum, that is the capitulum, touches its concave upper surface. Got it? And there is an annular ligament that is not attached to the radial head, that actually snugly fits with the radial head. The ligament, this is the radial head, the annular ligament, it snugly fits at the radial head. It doesn't attach anywhere. Right? So this is radio-humeral joint. Alright, capitulum with the upper concave surface of the radius. Right? Now you see the ulna. You can see the trochlear notch, the trochlea. Right? The lower part is this is trochlear notch. This is the big like trochlea. All right, olecranon process, and the lower portion is like this. This is called the coronoid process. All right. Here, two part gets attached. Number one, medial part, medial component, that is the medial part of trochlea. Second part is lateral part of trochlea with capitulum, and the most lateral part is the lateral epicondyle. Right? So from medial to lateral is medial epicondyle, medial part of trochlea, then lateral part of trochlea with capitulum, then the lateral epicondyle. These four components are there in the lower epiphysis of humerus. Okay. Can you read that out? Can you read that out? পড়া যাচ্ছে? জোরে বলবো না কি হলো? ছোট ছোট তো তোমরা ফটো একটুখানি কাছে জুম করা যাচ্ছে, তোমরা তো জুম করতে পারো। জোরে টানলে মুছে যাচ্ছে, বড় করতে গেলে আমার হাতে মুছে যাচ্ছে। So the lower epiphysis of humerus has a medial epicondyle, medial part of trochlea, lateral part of trochlea with capitulum, and then the lateral epicondyle. Right? You need to remember the appearance of epiphyseal center and the time of fusion of this epiphyseal center. Otherwise, you will not be able to diagnose whether it is a fracture dislocation or only dislocation or only fracture. কি বললাম? এখানে যে epiphyseal center গুলো রয়েছে, ঠিক আছে? I am telling you. So you have to remember the time of appearance of this epiphyseal center, that is primary and secondary epiphyseal center. What I named is the secondary epiphyseal center for the lower end of humerus. যেগুলো বললাম, ঠিক আছে, এগুলো কি secondary epiphyseal center for the lower end of humerus. Why it is needed to remember? Because otherwise you will not be able to diagnose only dislocation, only fracture and fracture dislocation. How we diagnose in clinics, how we diagnose a elbow dislocation. কি করে elbow dislocation diagnose করা হয়? You know, the tip of the olecranon process, the medial epicondyle and lateral epicondyle. This makes an isosceles triangle. Tip of the olecranon process, the medial epicondyle and the lateral epicondyle. This makes an isosceles triangle. We will palpate for this tip of the olecranon process, the medial epicondyle and the lateral epicondyle. All right. If any of the point does not corroborate with an isosceles triangle, then there is elbow dislocation. Now comes the elbow fracture. This is the epiphyseal line of the lower end of the humerus, and this part covers the medial epicondyle, right? Now we have, I have told you, 4 components of this elbow joint. 4 components of humerus in this elbow joint, right? Write down. They are the medial epicondyle, the medial part of trochlea, lateral part of trochlea and the capitulum. Medial epicondyle, the epiphyseal center for the medial epicondyle appears at 5 years. The lateral part of trochlea, epiphyseal center for the lateral part of trochlea, it appears at 10 years. Lateral part of trochlea with capitulum, and the lateral part of lateral epicondyle appears at 12 years. ठीक है? At 12 years. Now the medial epicondyle, medial part of trochlea, and the lateral part of trochlea. These fuses at puberty and fuses with the sap by 20th year. Fuses with each other at puberty and fuses with the sap by 20 years. So what kind of an epiphysis is this? কিরকম epiphysis এটা? What type of epiphysis is this? কিরকম epiphysis এটা? Lower end of humerus. When individual epiphysis fuses with each other, then fuses with the sap. This is compound epiphysis. And there is a separation. You see the epiphyseal line I have drawn. দেখা যাচ্ছে না না ঠিক আছে the epiphyseal line from lateral aspect to medial aspect, and there is a dipping separating the medial epicondyle. So when there is a fall in outstretched hand, there is a fall in the outstretched hand, then the elbow will be pushed backwards. That separates the medial and lateral portion of the epiphyseal line. কি করবে যখন আউটস্ট্রেচড হ্যান্ডে এলবোটা পড়বে ঠিক আছে সো দেয়ার আর টু ফেনোমেনা নাম্বার ওয়ান the force is directly transmitted to the elbow joint, and number two, its one component separates out the lower humeral epiphysis, then it's an elbow fracture. একটা পার্ট কি হলো এপিফাইসিয়াল লাইন থেকে একটা পার্ট এদিকে চলে গেল, একটা পার্ট এদিকে চলে গেল, ঠিক আছে, আর টিপ অফ ওলেক্রানন প্রসেসটা পাস করে চলে গেল, এই জায়গাটা পাস করে চলে গেল, এখন তো পাস করেনি, ঠিক আছে, যখনই এই জায়গাটা ফ্র্যাকচার করে যাবে তখন ওটা পেছন দিকে এগিয়ে যাবে, ঠিক আছে, দেন ইট ইজ এলবো ফ্র্যাকচার অ্যান্ড এলবো ডিসলোকেশন। অ্যান্ড হোয়াট ইজ সল্টার হ্যারিস টাইপ অফ ফ্র্যাকচার I will tell you later on, all right? I will tell you later on what is classification of Salter-Harris fracture. I will tell you later on. It is not easy. It is intra-articular fracture. So now I have described you the anatomy and the nature of injury that causes fracture dislocation of the elbow joint. Right? Now there are other things, that is the muscles supporting the joint, blood vessels and nerve. What are the muscles supporting this joint? Number one, the flexion is caused by biceps brachii, brachialis and brachioradialis. Write down. Flexion is caused by biceps, brachialis and brachioradialis. Extension is caused by triceps and anconeus. Pronation is caused by pronator teres and pronator quadratus. So flexion, extension, supination is caused by supinator and biceps brachial. Biceps is called supinator longus. Biceps, another name of biceps brachii is supinator longus. So supination is by supinator and biceps brachii. Pronation is by pronator teres and pronator quadratus. Flexion is by biceps brachii and brachioradialis. Extension is by triceps and anconeus. So blood vessels of the joint, it is easy, not much to write. That is the brachial artery and its two branches, radial and ulnar artery. Lower part of the brachial artery and the upper part of radial and ulnar artery supplies this joint. Now the nerves, blood vessels, then the nerves. There are 4 nerves that are intimately related to the elbow joint. There are 4 nerves that is intimately related to the elbow joint. Number 1, radial nerve, ulnar nerve, musculocutaneous nerve, and nerve to anconeus. Anconeus is a muscle of the extensor surface of forearm. Anconeus টা কোথায় আছে? এই ঠিক আছে, পেছন দিকে, ঠিক আছে, হ্যাঁ, আর প্রোনেটার টিরিসটা আছে মিডিয়াল এপিকন্ডাইলের নিচে, ঠিক আছে, মোস্টলি অ্যান্টেরিয়ার, ক্লোজ টু দ্য অ্যান্টেরিয়ার সারফেস, ঠিক আছে, anconeus is on the posterior surface. All right. So nerve supplying the anconeus is also present here. Now the most common complaint of elbow pain is not due to fracture or dislocation. Most commonly it is due to lateral epicondylitis, which is known as the tennis elbow, and medial epicondylitis, which is known as golfer's elbow, together with nursemaid bursitis, that is the bursitis of the olecranon process. When we read for a long time or do something in this posture, so the tip of the olecranon process gets a frictional injury, and there a pouch filled of fluid develops to absorb the friction. That is called the olecranon bursitis or nursemaid bursitis. So, lateral epicondylitis or tennis elbow, medial epicondylitis or the golfer's elbow, olecranon bursitis, and other fractures. And got it? Now, how will you handle a patient with fracture or fracture dislocation of elbow joint? তোমার কাছে একটা পেশেন্ট এলো, একটা বাচ্চা এলো, হ্যাঁ, supporting his forearm like this. If it moves, the child will cry in wincing pain. ঠিক আছে, প্রচণ্ড ব্যথায় কেঁদে উঠবে. So he will not allow you to handle it or maneuver it to find whether the fracture is there or there is dislocation is there. So that's why I have talked about the isosceles triangle, which will give you the idea whether there is any fracture dislocation is or there. ঠিক আছে? If it is confirmed that yes, there is a dislocation, there is separation of the tip of the olecranon process, medial epicondyle or lateral epicondyle. So the isosceles triangle is broken. Then you will be able to prescribe an X-ray of the joint, epi and lateral view or sometimes oblique view. If it confirms an injury with fracture and dislocation, then after doing an X-ray, then do an ultrasonography, CT scan or MRI, whatever. Why do we do it? কেন করে? Gentlemen, বলো, MRI আর CT কেন করে? What is the idea? এখন তো ছাগলের দেশ, পেশেন্ট এলো, ইউএসজি লিখে দিল, সিটি লিখে দিল, এমআরআই লিখে দিল, হ্যাঁ, রাজ্যের যা কিছু আছে সব লিখে দিল। ঠিক আছে? ইভেন ইন ইংল্যান্ড, রিমেম্বার, ইভেন ইন ইংল্যান্ড, rank below associate professor cannot prescribe an MRI, cannot prescribe an CT, and cannot prescribe higher antibiotic, injectable or higher antibiotic. Prescribe করতে দেওয়া হয় না তাদের, বুঝলে? পিজিটি তো প্রশ্নই আসে না। ঠিক আছে, অ্যাসিস্ট্যান্ট প্রফেসর লেভেলেও কাউকে এমআরআই প্রেসক্রাইব করতে দেওয়া হয় না, সিটি প্রেসক্রাইব করতে দেওয়া হয় না, ইউএসজি লিখতে পারবে, হায়ার অ্যান্টিবায়োটিক লিখতে দেওয়া হয় না। আই হ্যাভ আস্কড, why do we do an MRI or a CT scan? What is the idea? কেন করি আমরা সিটি স্ক্যান বা এমআরআই? The answer is, if I have a plan, if the fracture deems open reduction and internal fixation, if I need to fix this joint with open reduction and internal fixation, then I need to understand which fragment is where, and I need to bring them closer to fix them. So when I have a plan to do a ORIF, that is open reduction and internal fixation, then it is deemed fit that you do a CT scan or an MRI. ठीक है, अभी देखो ना, रोड ट्रैफिक एक्सीडेंट में थोड़ा सा चोट लगे, हाँ पहले CT किया, फिर MRI किया, फिर USG किया, करते ही रहते हैं. उसको पूछो क्या हुआ है इस पेशेंट को, वो बता नहीं पाएंगे. कैसे उसको समझते हैं कि ब्रेन इंजरी हुआ है नहीं हुआ है. ठीक है, concussion injury, whether there is any concussion, at least a concussion injury, I am not going to lacerated injury, nothing, only concussion injury. उसको कैसे समझते हैं? जैसे बोले ना आप लोगों को कि एल्बो फ्रैक्चर को ऐसे, डिसलोकेशन को ऐसे समझते हैं थ्रू द आइसोसेलेस ट्रायंगल. So what is my idea doing an MRI or CT scan? When I have a plan to understand whether there is fracture dislocation and I am going to fix it by open reduction and internal fixation. If I have no plan or opportunity to fix the joint or fracture by open reduction and internal fixation, क्या कर लोगे तुम इसको? ठीक है, एक स्लिंग दे दो, एक ब्रेस दे दो, वो रह लेगा. डन. एल्बो जॉइंट को छोड़े, खत्म करो एल्बो जॉइंट. एक रिस्ट जॉइंट के लिए एक मजे छोड़ दूंगा अभी. रिस्ट जॉइंट के लिए एक मजे की बात बताता हूँ. रिस्ट जॉइंट की है, देयर इज separation of the ulnar head from the radiocarpal joint. Ulnar head is not included in the ridge joint. Ulnar head is not included in the ridge joint. The triangular articular disc that is attached from the margin of the lower end of radius to the depression at the styloid process of ulna. Right? So head of the radius is separated from the radiocarpal joint or the ridge joint. ठीक है. There is an interesting phenomenon. During evolution, at one stage, ulnar head is entering into ridge joint. Yes, at various stages of evolution, at one point, this ulnar head is entering into the formation of ridge joint formation. At a very subsequent stage, the ulnar head is again separated from the ridge joint. Again separated from the ridge joint. Can you name one animal where the ridge joint is made up of ulnar head, ulna is included, and other animals you know that ulnar head is separated out from the ridge joint? বলো, ulnar head ridge joint included আছে এরকম একটা অ্যানিমেলের নাম বলো. আর ulnar head ridge joint included নেই, সে তো বলতেই পারবে, ম্যামালিয়া সবাইকে বলতেই পারবে. ঠিক আছে, है ये, इसको क्वेश्चन आंसर करके रखोगे, हम आके सुनेंगे. राइट? शुड आई कंक्लूड एट दिस पॉइंट? ओके, थैंक यू वेरी मच.